Hello guys, I am Dr. Pawez Ahmad Rishi. This is presentation for medical students. Anderson's triad, bronchiectasis, cystic fibrosis and vitamin A deficiency. In Anderson's triad, we have BCV, bronchiectasis, cystic fibrosis, vitamin A deficiency. Beck's triad of parapharyngeal abscess. In parapharyngeal abscess, we have Beck's triad, that is external cervical swelling, trismus and internal swelling. We have an external swelling, we have trismus and internal swelling. So external swelling at the submandibular region which is tender due to spasm of medial pterygoid, internal swelling of the lateral pharyngeal wall, pushing the tonsil medially. It pushes the tonsil medially. Internal swelling pushes the tonsil medially. This is Beck's triad of parapharyngeal abscess. Beck's cognitive triad, negative thought in depression. What is Beck's cognitive triad? Negative thought in depression. Negative thought of self, negative thought of environment, negative thought of future. Guys, we have two triads of Beck. One is in ENT, another is in psychiatry. In psychiatry, we have cognitive triad, that is self, environment and future. All the three are associated with negativity. Beck's triad of cardiac tamponade. What is Beck's triad of cardiac tamponade? Decrease of systolic blood pressure, distended jugular vein, diminished heart sound, quite hot, quite hot. So it is in the cardiac tamponade. We have decreased systolic BP, distended jugular vein pressure and distended jugular vein, diminished heart sound, quite hot. These are three things in cardiac tamponade. Cushing's triad is a late sign of increased intracranial tension, hypertension, respiratory depression and bradycardia. Cushing triad is a late sign of increased intracranial tension, hypertension, respiratory depression and bradycardia are the three signs in it. Ecological triad of disease. Causative agent, host and environment. Causative agent, host and environment are the three triads of or the three components of ecological triad: agent, host, environment. Gardenigo triad of petrositis. Persistent otorrhea, ipsilateral retroorbital pain due to irritation of nearby trigeminal ganglion, ipsilateral sequent and diplopia due to paralysis of sixth nerve. So what is Gardenigo triad of petrositis? Very important. Otorrhea, ipsilateral retroorbital pain, ipsilateral sequent and diplopia. So remember ear and eye. Otorrhea, pain in the left eye or right eye, and then we have sequent on the right eye or left eye. We have diplopia. So we can say that Gardenigo triad, persistent otorrhea, ipsilateral retroorbital pain due to cranial nerve 5 involvement and 6th nerve involvement. 5th nerve, 6th nerve and otorrhea. Trotter's triad is diagnosis for nasopharyngeal carcinoma. What is Trotter triad? Trotter triad. Unilateral conductive hearing loss, secretory otitis media. Unilateral conductive hearing loss, ipsilateral earache, facial pain, and ipsilateral paralysis of soft palate. We have Trotter's triad is diagnostic of nasopharyngeal carcinoma. We have unilateral conductive hearing loss, ipsilateral earache and facial pain, trigeminal nerve involvement, ipsilateral paralysis of soft palate. Classical triad of Hinock-Schonlein purpura. Hinock-Schonlein purpura, so as the name indicates, purpura, arthritis, abdominal pain. Purpura, arthritis, abdominal pain. Triad of Hinock-Schonlein purpura. Virtue triad is the etiology of thrombosis. Damage of vascular endothelium, stasis of blood, change in blood composition, increased coagulability. Mnemonic is virtue. Vascular trauma, increased coagulability, reduced blood flow. Charcot triad of acute cholangitis. Fever with rigors, right hypochondriac pain, and jaundice. Charcot triad of acute cholangitis. Fever with rigors, right hypochondrial pain, jaundice. Atos triad of bilharzia, dysentery, bleeding per rectum, polyposis, clubbing of fingers. Atos triad of bilharzia, dysentery, bleeding per rectum, polyposis, clubbing of fingers. Saint triad, diverticulosis, gallstone, hiatus hernia. Samter's triad, aspirin sensitivity, asthma, nasal polyp. So this is Samter triad, aspirin sensitivity, asthma, nasal polyposis. VOGT triad of tuberous sclerosis, facial nevus, adenoma sebaceum, seizure, mental retardation. Whipple's triad of insulinoma, signs and symptoms of hypoglycemia, serum glucose less than 2.5 millimoles per liter, relief of symptoms on administration of glucose. Hemophilia triad of Sandblom, melena, obstructive jaundice, biliary colic. We have O'Donog's triad, twisting force in the weight-bearing knee joint causes injury to medial collateral ligament, anterior cruciate ligament, medial meniscus. Pentology of Fallet's tetralogy with, in addition, a patent foramen ovale or atrial septal defect. Pentology of Fallet's tetralogy with, in addition, a patent foramen ovale or atrial septal defect. Triad of mercury poisoning, excessive salivation and gingivitis. Danbury tremors, very severe, concussio mercurialis. Neuropsychiatric illness, erythrism. Triad of Meigs syndrome, benign tumor of ovary, fibroma, ascites, pleural effusion. Triad of Meigs syndrome, benign tumor of ovary, ascites, pleural effusion. Thank you. Please like and subscribe.